I do things in the surgical ICU, and I also work downstairs in the ED setting. On my non-clinical side, I take care of the critical care fellowship. I'm one of the co-directors of the anesthesia program as well as the EM program, and I'm involved with both fellow and resident education. So my favorite part about working here, it's a great hospital with broad patient exposure. We really do provide the best of the best care. I think both downstairs in the ED setting as well as upstairs in the critical care setting, the exposure to patient population, what we can offer the patients, and the ability to basically provide care for them can't be matched anywhere else. We have the largest critical care fellowship program, at least from an anesthesia standpoint, in the country. We're a very multidisciplinary program, so we take surgery, anesthesia, and EM trainees into our program. Our program has a 1-year track for our surgery and anesthesia colleagues and a 2-year track for our EM trainees. It is a multidisciplinary approach to critical care. Our fellows get exposure to medical settings, surgical settings, cardiothoracic settings, neuro settings, kind of a great exposure across the board to all the things they will see as an intensivist for their practice pattern. And I think really from the clinical load to some of the things we do outside, from didactics and how to run an ICU, I think they get a great exposure of how to be an intensivist. I think the breadth of experience really comes from the mixture that we get at this institution. So there's plenty of hospitals that may have a, for lack of a better term, a county seat, and then they may have a private hospital setting, and usually 2 different buildings. We get kind of that mixture here at WashU where all of our patients are under the same roof. It makes for a large hospital. We have over 1,000 inpatient beds. But the benefit of that is you get that broad exposure to both sides of medicine, and I do think it makes for a better clinical and training opportunity. Originally not from St. Louis, I'm from the East Coast. I kind of dragged my wife here from the Western Mountains, and she kind of came kicking and screaming, but the reason why we've stayed is because of the hospital. I think Barnes Hospital and the WashU setup is unique. And really, I think if my wife had her brothers, we'd be further out west towards mountains, but we've found a very happy life here because of the hospital. You know, I really do get excited about working with our fellows. To be honest with you, the educational exposure we get with them, and it's not just education of the fellows, but really, you know, on rounds, both in the ED setting and up in the ICU setting, you know, education that we do as far as talking about why we're using pressors or ventilator modes or why we've chosen a certain type of strategy for patient management. From nurses to RTs to our nurse practitioners, there's education that kind of happens all the time, and I think that's a great component of medicine. Keeps all of us on our toes. Makes me want to do a better job with reading at night, making sure I understand what's going on with our patient population, and hopefully be able to share that with our colleagues as we talk about things. I would definitely agree that we have a great spirit of collaboration, and that really transcends different departments. So I think you bring up a good point. At an institution this size, sometimes you can feel like you may get lost, but really between departments of surgery and medicine and anesthesia and EM, I think we've done a good job at hopefully making us kind of work across party lines and have some of that multidisciplinary approach where folks are working together and hopefully providing the best care for the patients. I think first and foremost, come see us. I think that's a huge component of any decision, is to go see the physical plant and talk to the people that work there. I think do your research online. So look at some of the materials we have on our website. But then I think talk to the trainees that are there and maybe the graduates from the program. I think WashU you will find to be a very unique exposure and a unique experience because of what people get to experience here, and then you'll be able to talk to our graduates and realize the positive things they say about their training experience.